Welcome to the Record on the Road. I'm Mark Maxwell, reporting from the old site of the Mallinckrodt Chemical Works. The records underlying this piece of St. Louis history date back to before the building of the Arch. It was nearly 80 years ago when American scientists helped to forge the atomic age. In the race to win a war and later beat the Soviets to the bomb, the government left behind something else, a trail of contamination and a legacy of secrecy. The Radiation Exposure Compensation Act, or RECA, was the government's first official acknowledgement that pursuit of nuclear supremacy had made American citizens sick. Now that program is expanding.
Let's just take a walk down memory lane for a second. Let's remember what the federal government did. Beginning in the 1940s, the federal government dumped nuclear waste and radiation into Coldwater Creek right here nearby us. It put radiation, nuclear material into our landfills. It dumped it in Laddie Avenue, all over the city.
That was Senator Josh Hawley on Tuesday near Coldwater Creek, a separate part of the contamination that spreads across the parts and regions of North St. Louis and North St. Louis County, celebrating the passage of the compensation and its expansion that was folded into a massive spending package on Capitol Hill.
This year, we got it included as part of the big, beautiful bill, and they said again, oh, it won't last. You'll never get it through all the way. Well, I tell you what, finally last Friday, when the president put that pen to paper, something historic happened. The largest expansion of the RECA program in the history of the United States.
In terms of tangible results for his constituents, this might well be the single biggest legislative achievement and win for Senator Josh Hawley in his now second term on Capitol Hill, a major legislative milestone that cannot be denied. But it also represented a groundbreaking milestone for advocates who spent decades trying to persuade their neighbors and their own government that the truth and dangerous chemicals had been buried.
After decades of being denied,
I can't believe this today is real.
Mothers who would not be silenced overpowered a government that kept deadly secrets.
This fight was so hard. It's the hardest thing I've ever had to do.
Dawn Chapman speaks for thousands of Americans. Her fight was not merely against illness or ignorance. It was against the very institution that should have protected her family.
Our government made it harder. They did everything they could to hide the truth from us.
The power of that truth overcame surviving mothers and widows who lost loved ones to exposure to radiation, buried or spilled in the ground below Coldwater Creek, or mined from a desert far away.
Half of all uranium ever extracted in this country came from the Navajo Nation.
Now that Congress has expanded the Radiation Exposure Compensation Act, or RECA, eligible applicants in specific areas of exposure can claim up to $100,000 for medical expenses. Some who developed conditions where it's harder to prove a direct link still won't qualify.
My son.
Even still, there are some things money can't buy.
Today, I feel seen.
Mothers from Missouri locked arms with daughters from the Navajo Nation, where during World War II, U.S. Marines would recruit Navajo natives like Maggie Billman's dad to talk in secret code and keep the atomic bomb and its ingredients a secret.
I promised to fight for Rika and his memory.
Now, in bringing the lingering effects of that closely guarded government secret to light, she and her fellow advocates have earned new titles.
You became researchers, historians, healers of this community, and most of all, heroes.
I refuse to call them victims. They're survivors. They're heroes.
Help will soon be on the way. Application forms put together by the Department of Justice will allow people in the American Southwest to apply for up to $100,000 in direct payments. In the St. Louis area, the zip codes listed are areas where people with certain illnesses that have some direct link back to this radiation exposure can qualify for payments of up to $50,000 if they're still alive, or people who died with those illnesses, their family members and surviving family can claim up to $25,000 apiece. But beyond the benefit, there was also an interesting political moment of some intrigue to local political observers. If you watch this moment when Senator Hawley, of course a Republican, turned and offered a very public embrace to a rather prominent politician who most recently lost her last election.
Right behind me to my left, maybe fittingly, I've got Corey, and I tell you what, here's the truth. Corey Bush and I, we worked together hard on this thing, and there was a time, it was a year ago this month, I think actually, when the majority in the House of Representatives tried to undermine us. They tried to move a short-term extension of RECA that had no expansion. Nothing for anybody who is here today, nothing. mark my words, if they had done that, that would have killed this effort. It was an effort to kill it. And I still remember the day that I got the news, and we had like a very short notice. It was one of these deals where I tell you how the House works. They put a little notice up on the calendar about something they're going to vote for in short time. I saw that notice pop up, and I said, we're in big trouble. If this thing passes, we're in big trouble. Who's the first person I called? Cory Bush. I got on the phone, and I said, Cory, we got to do something. I said, we got to do something. They're trying to steamroll us. And Cory said, I will get every Democrat to stand up against this. I said, I will call all the Republicans who are standing strong on this. And you know what? We stopped it. We stopped it. And because we stopped it then, we got it passed last week. And so here we are today. So Cory, thank you. Thank you. We would not be here without you and your work.
Remember that moment, if and when former Congresswoman Cory Bush ever decides to run for her old job once more. The person who beat her for that job, now holding it, Congressman Wesley Bell, also in the crowd. He took part in the celebration, but of course voted against the legislation that paid for it. I asked him to explain that apparent contradiction. For Congressman Bell, you're here today, but you, of course, voted against this bill that pays for it. Can you explain your vote?
Well, I think that what we understand is we're all grown-ups here, and you're not going to always get everything you want. And so there are some concerns and issues that many of us have with this budgetary bill. But at the same time, the folks who have been waiting a long time for compensation, to be acknowledged for the pain and suffering, that's one thing that I can rejoice in. And so we're going to open our office as well to help and facilitate getting the word out, helping folks apply for these resources, just like we've done with FEMA disaster relief in North County, in North St. Louis. But the last thing that I'll say is that this is an example of why it's so important for all of us to work together. This was an effort from grassroots up to the federal level and everybody in between. There are state reps here, there are state senators here, there are mayors here, there are county executives, there are county council persons who are here who have all been in this fight. And so I've always said, if Senator Hawley, we don't always agree on everything. But when we do agree on something that is benefiting this region, we're going to work together. And so, yeah, the fight is still on. 63106, 63107. We need to expand RICA for those, so we're not done. Medicaid, we're going to fight and push to push back on what happened in this bill with respect to Medicaid and how it impacts so many people. So the work is not done, but this is one piece of that bill that I can be happy about and happy for the folks standing behind.
Welcome to Washington, where the sausage is made. Projects you like get stuffed into bigger things you don't, and at the end of the day, our elected officials have to make a tough call, a vote, up or down. Senator Hawley made a similar argument, explaining the incremental nature of legislation and the way bills become law, as he talked about the path forging your way through disagreement to something that represents compromise. And on the tax side, 1 year ago this month, you called for a grand national debate about a tax policy that was more fair to workers, families, and not so much favorable for corporations. Was this the fair tax policy you had in mind?
Yeah. You know, listen, we made some progress here. We've got no taxes on tips, no taxes on overtime, no taxes effectively on Social Security. That's a big, the president campaigned on those things, I campaigned on those things. That's a plus. But Mark, there's a lot of work to do. Working people deserve to have even more tax relief. I don't think that Wall Street needs any more tax relief. So I would say that this is a start. I think that the efforts, the blue collar tax cuts that I just named, those are real. Those are going to affect people. There's the child tax cut as well, which is in this bill. So that's good. You know, I mean, listen, legislation is about taking one thing at a time, and we learned that in this fight. You take one step, and then you take the next step, and then you take the next step. So we got some real wins in terms of blue-collar tax relief, but there's a lot more we could do.
One step at a time, as long as you're pointing in the right direction. Hawley, a former prosecutor, framed this Radiation Exposure Compensation Act as a fight about morality, justice, and honesty.
RICA is the government saying, what we did was wrong, lying to you was wrong, and we're finally going to make it right.
But making it right carried a significant cost. You might call it a trade-off. Just 2 months earlier, in the pages of the New York Times, Senator Hawley issued a stark warning. Don't cut Medicaid. You built something of a national soapbox, saying that cuts to Medicaid would be morally wrong, politically suicidal, and whether or not rural hospitals were forced to close now or later, this bill would eventually force their closure. How do you think voters in Missouri feel hearing you say all that and then vote for it anyways?
Well, I hope that they feel that and recognize they're going to get $1 billion more in rural hospital funding in the next 4 years because of our efforts. Missouri is actually going to see an increase of $1 billion for rural hospitals from now to the end of the decade because of this legislation, and specifically because of provisions that we got put into legislation, number one. Number two, there will be no effects, no change to Missouri's hospital funding until the next decade, 2030. We got all of that delayed until then, and I'll do everything I can between now and then to make sure that there are no cuts that ever take effect to Missouri hospitals. But I want to be clear, for the next 4 years, Missouri will see an increase over baseline of $1 billion, $1 billion, to rural hospitals. That's a lot of hospitals in our state, and we will see no benefit cuts whatsoever, again, because of compromise language we were able to win and get put into the bill. So there's a lot of work to do on this. I think it's a mistake to cut Medicaid. I've always said that. I continue to believe it. We have prevented it from happening in Missouri for the rest of this decade, and in fact got an increase in funding. But I'm going to dedicate myself, with all the urgency I've dedicated myself to this fight, to seeing that in the 2030s and beyond, there are no Medicaid cuts that take effect in Missouri.
There are a lot of numbers there. Let's start to dig into them. We'll start by saying that rosy picture the senator paints is heavily disputed. Let's start with this stark warning from A.J. Wilhelmi, for example. He's the president and CEO of the Illinois Health and Hospital Association. He writes in an email to us, Medicaid cuts of at least $1 trillion over the next decade would deliver a crushing blow to Illinois and the region, undermining healthcare access, decimating hospital funding, and eliminating thousands of jobs. Wilhelmi says the Senate's version of the One Big Beautiful Bill Act makes a devastating bill apocalyptic, advancing policies that he says would destabilize care across Illinois and the country. Wilhelmi says these cuts would sharply erode access to care, especially in rural and underserved areas, and force hospitals to reduce services, lay off staff, or close entirely. The impact, he says, would cross state lines because healthcare does not stop at the border. In the St. Louis metro area, more than 300,000 people depend on the Medicaid program, he says, and tens of thousands could be expected to lose coverage. He says further, Illinois stands to lose a minimum of $2 billion in Medicaid funding annually. That loss would ripple through our state economy, shifting the burden of uncompensated care onto hospitals already under financial strain, rather. Lastly, he says these aren't just budget numbers. They represent real people, patients who will lose the coverage they rely on, providers who may be forced to scale back or shut down critical services, and communities that could be left without the essential care they need to survive. Trying to predict for certain the future of federal health care policy can be uncertain work, but there are facts that remain concrete. The bill creates a national $50 billion rural hospital fund. It would spend $10 billion a year over a 5-year window across the entire country. It's not a guarantee that $1 billion a year would go to Missouri, or $1 billion total. That's not how it's spelled out in the plain text of the law anyways. Half of the funds are at the discretion of CMS. The other half require states to apply with detailed plans spelling out how they would spend that money. So what else can we really know for sure? Let's dig a bit further into some of the claims Senator Hawley made. Is Hawley right when he says that, quote, Missouri is actually going to see an increase of $1 billion for rural hospitals? Is it really true that there will be no effects, no change to Missouri's hospital funding until 2030? The senator tells us, quote, we will see no benefit cuts whatsoever because of, quote, compromise language we were able to win. For the record, I have asked his office for that compromise language and for the math that would back it up. So far, we have not yet heard back. Of course, in the end, the record will ultimately speak for itself. If hospitals close, we'll know. If Missourians lose their health insurance benefits, we'll know that too. And if rural hospitals ever get their hands on a portion of that rural hospital funding, we'll know that as well. But between now and then, there are also a handful of experts who know the process inside and out. One of them is named Emily G. Emily was an economist in the office of the Assistant Secretary for Planning and Evaluation at the United States Department of Health and Human Services. So suffice to say, she's very familiar with how Medicaid works and its relation to the Affordable Care Act, which greatly expanded Medicaid in Missouri and across the country. She worked there during the Obama administration, and today she works for the Liberal Center for American Progress. so she's no ally of Hawley's politics, but her experience is real, and her analysis raises critical questions. Back at the station, we connected over a video call to run through several different ways this massive overhaul to the nation's largest health insurance provider could change things for patients and hospitals alike.
I'm glad we have a chance to catch up because you have experience that I couldn't have. Can you give our viewers a sense of how you came to know so much about this Medicaid payment process?
So I was an economist at the U.S. Department of Health and Human Services in Washington, where I worked on the Affordable Care Act and healthcare coverage issues. And I'm now at the Center for American Progress in Washington, D.C., which is a independent, nonpartisan policy institute.
Okay. So you had some close experience there. Of course, this bill changes a lot of things for a lot of different people. Can we start first? So there are the Medicaid recipients, the patients. There are the states that participate in Medicaid and the way they administer it. Then there's the way the states get reimbursed from the federal government. And then there are the rural hospitals and the providers. All of them, I think, are affected here. Is that fair to say?
Yes, this is a bill that will have sweeping effects for across the healthcare system, for the providers, for patients who are receiving care, and for reimbursements that then flow to medical providers.
Can we start by looking at the claim that no one in Missouri will be affected? If we just zero in on the patients and the work requirements and the process of going through that, is it possible that some people will lose their benefits?
I think it's not just possible, it's almost guaranteed that people are going to be losing benefits. This bill has, or it's the law now, this law has the largest Medicaid cuts ever in US history. And the only way that one can get savings of this magnitude, cuts of this magnitude, is that people are going to be losing coverage. According to the Congressional Budget Office, about 16 million people will be losing coverage nationwide by 2034.
That's the timeline piece, is that this all doesn't snap in right away. So can you help me understand when it comes to states and their budget process? A lot of them have been using this provider tax to basically beef up how much federal money they can rely on to fund their Medicaid expansion.
So the law would sort of cap the amount that states can tax providers, which is a crucial way for states to be able to raise the money needed to cover all the costs of their Medicaid program, including for the Medicaid expansion. And so what the law does is it puts into effect immediately a cap. There is a phase-in the bill as passed that would not reach its full effect until 2032, but that is something that that hospitals and other providers will have to start planning for right away as they think about their long-term financing.
So I guess that can open up a number of different doors. Either states can say, okay, we're going to find that money somewhere else and continue expanding Medicaid. And Missouri's constitution requires us to do that. Or they might have to make cuts somehow. Am I missing something?
These are going to be devastating cuts for states. The scale of the cuts in this law, and also just the deeper pockets of the federal government, mean that these are not cuts that states can absorb. And particularly because, unlike the federal government, this law just spent trillions in deficits over the next decade. States often have to balance their budgets. For Missouri in particular, this law is expected to reduce federal Medicaid dollars by about $17 billion over the next decade.
Okay, so we've talked a little bit about the patients who are going to have to start filling out more paperwork, and even just by the bureaucratic process, some of them in the churn of all that may be kicked off the rolls, even if just temporarily. The state budget, slowly but surely, will start to have to take on more of that burden, or will have to limit the number of people who qualify. So there's a couple of those kinks in the hose as we get closer to the big funding question here. But then there's the rural hospital fund. Can you explain, and I think this is where, if I understand correctly, you were closely plugged into how this might work. What would a rural hospital have to do to qualify for their share of this $50 billion?
So it's not perfectly clear from the language in the law there's no precise formula for how this money would be allocated. States would have to apply for it. It is also not exclusively for rural hospitals. It's a rural healthcare development fund. So the money could go to things like, healthcare quality improvement interventions. It might go to help treating chronic illness. It could go to workforce expansions. And so states will need to apply for the money, and then that money will get doled out according to a formula that CMS, the Centers for Medicare and Medicaid Services in DC will, or probably over the coming months or year, we'll figure out. So it will depend on, what the rural population of a state is, where rural providers are located, what share of rural hospitals and providers the state has relative to the national. And so when Josh Hawley is saying that he has brought home $1 billion to Missouri for rural hospitals, that is just, plainly not true. There's no guarantee that will be the slice of the pie that Missouri gets. There's still a lot we don't know about how the Trump administration will decide to allocate this money. It's also just funding for 5 years. After 2030, there's a cliff. So Missouri, is facing $17 billion in less Medicaid funding. And then on a national scale, just to put this into context, the Kaiser Family Foundation, KFF estimates that rural areas of the country will lose about $155 billion in federal Medicaid funding over the next decade. This fund is just $50 billion.
And the fund allocating those $10 billion a year for 5 years, totaling up to $50 billion, states would have to get in line. Maybe individual hospitals too that would get in line to fill out these applications, and in so doing, it looks like they would have to meet a number of strict guidelines. Like they'd have to come up with a strategy to show that they are financially sustainable in order to qualify. That seems like a catch-22.
Correct. So states are responsible for coming up with, my understanding is states will be responsible for coming up with plans for how they would spend this money. Again, it's not all about rural hospital sustainability, but they are supposed to have that in goal as their goal. But the irony is, like, this law is the most destabilizing thing you could do for hospitals, and in particular for rural providers.
Can you give us some sense of what is the market stress on these rural providers in the first place? Is it just that there are so few people, scattered few and far between, and it's not a very densely populated area, and therefore it's just not as, I'm going to use the word, profitable? Is that basically it?
It's partly a population problem, but it's also, it's a public service that you don't want people to have to drive, 6 hours, 3 hours to be able to deliver a baby or get seen for a car accident. And so, many of these rural hospitals are very small. They might, a big city hospital might have hundreds of beds. A small rural hospital might have a single digit number or 20 beds. And so, there are less economies of scale, but again, that's something that we feel like is a necessary service of being able to deliver medical care to people. So, it's lower margins, and they also are often delivering fairly low margin services. So they are not doing the type of fancy surgeries that a major academic medical center might. They're doing psychiatric care. They're doing labor and delivery. Those aren't big money makers.
That's where this list came from, I think. There was a list going around showing which rural at-risk hospitals were basically on the front lines of this fight because their margins were so low, their customer base or patient population their patient pool was so low that they weren't operating in the black. Many of them were operating in the red. What happens to places like that if even 5-10% of their patient pool is no longer insured, if they don't have money to pay for the services? I imagine they still show up to see a doctor in some cases. Then
Hospitals will close. In fact, Josh Hawley himself had said earlier in his New York Times op-ed that if Medicaid cuts happen, hospitals will close. And this is not a hypothetical. We've seen dozens of rural hospitals close over the last several years. That is concentrated in states that haven't expanded Medicaid. So that tells you a lot about how important Medicaid, and in particular Medicaid expansion, are for hospital sustainability.
In your time there in the administration, did you see any of the evidence that would lead you to believe that there were even trace amounts of waste, fraud, or abuse, or was it more a rounding error, so to speak? How would you describe or define? We know there is some Medicaid, Medicare fraud out there. How much of it did you see?
So I will say I was in a role where that was not a focus of my work. And just to clarify, I was a career civil servant during the Obama administration. But what I will say is, Republicans have been using, talk about fraud to try to justify these cuts. These are the most vulnerable people who are, low income people, disabled people, children who are on Medicaid and CHIP coverage. You know, that's not to say there isn't fraud in Medicaid, but a lot of that happens to be from providers, from billing that is incorrect, from stating there were services delivered or devices, goods that were delivered that were not. It's not about people signing up erroneously. Sure, there are things that need to be reconciled. Sometimes someone might move and they it takes them a while to figure out paperwork, or their income might increase and they need to go back and change their paperwork. But those cases are rare.
Yeah, I'm trying to imagine the fraudster who would think, I've got to scheme up a way to get a free couple pills at the prescription counter. It seems like low reward.
Yeah, so this is a sort of a misnomer that I've heard Trump sometimes say, that people are sort of double, taking into Medicare. This is the Medicaid twice. Medicaid is not a cash assistance program. Medicaid is health coverage, and so you are not receiving a Medicaid check. What you have is health coverage, so that when you need a vaccination, or your kid needs an annual physical so they can go play sports at school, or you get in a car accident, you have that financial backstop against medical costs.
So at the crux of all this, just to summarize what we've kind of gone through here, more people are likely to lose their benefits, even if just temporarily, in the near term in Missouri. More providers are likely to feel financial pressure. The state itself is likely to feel some budget pressure to possibly crimp the choke point through which people can access that benefit, that healthcare benefit in the first place. And in the end, that lifeline of $10 billion available for the whole country, some small amount of that may or may not ultimately come to Missouri. Did I understand all that correctly?
That's correct. Can I also add two more things that, besides, I think the work requirements have gotten a lot of, rightly gotten a lot of attention, because we know from experience in Arkansas and in Georgia that people who are working end up getting kicked off coverage because of the complicated paperwork. I think the provider taxes that go to support Medicaid, to fund Medicaid programs in the states, just received a lot of attention. But there are also some other measures that go into effect before 2030 that will directly, affect Medicaid enrollees. One is a provision that goes into effect in October 2028, which requires states to impose cost sharing on people just above poverty. So if you're a family of four, a family making $32,000, not a lot of money, you will have to pay $35, say, to go see a specialist, and you may have to pay up to 5% of your income toward out-of-pocket costs.
And those are new fees?
This is new, that the federal government is for the first time requiring states to impose cost sharing. Some states have done this in the past, some nominal fees, but this is Congress saying that essentially people who are low income, by definition of being on the Medicaid program, need to pay out of pocket for necessary medical care. That when people become uninsured, they still need care. They don't stop needing prescriptions. They don't stop, breaking a leg. They don't stop having a kid with a really dangerously high fever. They still need medical care. And so when people who don't have care show up at hospital, the hospital, under a federal law called EMTALA, has an obligation to stabilize people in emergency, even if they don't have the ability to pay. And so hospitals can end up saddled with, uncompensated care costs that they need to eat. Might be that people come and need surgery but can't pay the full bill. And so what we expect to see as a result of 210,000 more Missourians being uninsured is probably about $475 million in uncompensated care burden on providers of the state by 2034.
So to say that another way, 210,000 people over time will continue to get sick. Many will show up to the hospital, may or may not have a way to pay for it, and the hospitals are required under federal law to provide the care and eat the cost or make it up somewhere else.
Yes, so they will often bill people, sometimes go to great lengths to recover that money. But if someone shows up in an emergency room and needs care in order to be stabilized, by law, the hospital is obligated to treat them. And so again, by 2034, about over 200,000 Missourians will be uninsured, which means when they get gravely ill, or we have experienced some sort of medical trauma, they will still need to get that care, and hospitals will be on the hook for making sure that providers get paid, their doctors and their lights stay on, the nurses get paid for that work.
Well, thank you for your time. I appreciate you adding some insight here.
Thank you so much, and appreciate your asking everybody around tough questions.
Trying to. See ya.
So, how do we sum it up? It seems that partisan and nonpartisan budget scorekeepers say that Medicaid cuts are coming, even after Senator Hawley said don't cut Medicaid. Yes, he pledges now to fight against those in the future. Perhaps he will do so effectively. We see now some tangible evidence that he did get a significant piece of legislation across the finish line. But look, here's what it all comes down to. Politicians are allowed to evolve. Some people, in primary elections especially, try to insist that their politicians remain steadfast and true and never change their minds. But politicians are allowed to be wrong, and they're allowed to learn. They're allowed to change their positions, especially if they say so, and explain how their thinking has evolved once they learned new information. But what happens when their actions conflict with their own words? What then? When they say one thing and then vote the other way, what are we supposed to think? As this bill was becoming law, or getting closer to that part of the process, Elon Musk slammed the bill for a different reason. He said it was exploding the deficit. In Missouri, a different kind of deficit is growing, one of credibility. From the vote over Fort Leonard Wood housing, to voting for infrastructure, now to Medicaid. A politician who says one thing and does another. Until next time, we're off the record.